All right, today we're going to talk about a word you've heard a million times, probably in movies, on TV, shock. But what does it really mean when a doctor says someone is in shock? I'll tell you right now, it is so much more than just a bad surprise. Let's dive into the body's ultimate crisis mode.
Right. So, when your favorite character on a show gasps and says, "I'm in shock," after some huge plot twist, they're talking about an emotion. But in a hospital, shock is a code red, sirens blaring, life-or-death emergency. It's the body screaming that something has gone terribly, terribly wrong.
So here's the bottom line, the absolute core of it all. Medical shock is a crisis of oxygen. That's it. It means the tiny cells and tissues all throughout your body are literally starving for oxygen. You got to think of it like a supply chain. For your body to work, every single cell needs a constant delivery of O2. When that supply chain breaks down, the whole system starts to fail.
Now, this is where it gets really fascinating, down at the chemical level. When those cells are starved of oxygen, they don't just give up. No way. They switch to a backup generator, something called anaerobic metabolism. The problem? This backup plan is messy, it's inefficient, and it comes with a really nasty side effect. It creates lactic acid. And this acid starts building up, making the blood toxic and poisoning the system from the inside out.
But you know what? Our bodies are incredible fighters. They don't just let this happen. The second that oxygen supply dips, a massive body-wide alarm system goes off. The body knows it's in deep trouble, and it launches this desperate, all-hands-on-deck defense to try and fix things. So let's look at exactly what that fight looks like. So, first, the crisis is detected. Instantly, the sympathetic nervous system, you know it as fight or flight, kicks into high gear. The body starts making some tough choices. It reroutes blood away from places like your skin and your gut and sends it straight to the VIP organs, the brain, the heart, the lungs. And this heroic effort, it causes changes in a patient's vitals that we can actually see.
And check this out. This is one of the very first clues that clinicians look for. It's called the pulse pressure. That's just the gap between the top number and the bottom number of your blood pressure. Normally, you've got a nice wide gap, like 120/80. But in shock, the body clamps down on the blood vessels to keep the pressure up, and that gap starts to narrow. See that? 100/90? That is a classic, textbook sign that the body is fighting for its life.
So, okay, why does this all happen? Well, there are basically four main ways the system can fail. Let's start with the easiest one to picture, the empty tank, which is officially called hypovolemic shock. This is, plain and simple, a volume problem.
So how does the tank get empty? Well, the most obvious way is hemorrhagic shock. That's literally bleeding out from a major injury. But it can also happen from some really complex stuff like DIC, where the body gets confused and uses up all of its clotting materials in all the wrong places. This means there's nothing left to stop the bleeding where it's actually happening, and you end up losing a ton of blood volume internally.
So how do you fix an empty tank? Well, you fill it back up, right? And you do it fast. That means pumping in IV fluids as quickly as possible, and if the patient has lost blood, you got to replace it with blood. You replace like with like. It is a frantic race to restore that volume before the organs start shutting down for good. Okay, on to our second failure mode. What if the tank is full of fluid, but the pump is broken? That brings us to cardiogenic shock. In this case, the heart itself is the problem. It's failing, and it just can't squeeze hard enough to push the blood where it needs to go. And when the pump is failing, you see some really distinct signs. Because the heart can't push blood forward, it backs up, like a traffic jam, right into the lungs. This causes fluid to build up, and a doctor can actually hear that as crackles. The pulse gets weak and feels kind of thready. Blood flow to your fingertips gets so bad that capillary refill, you know how fast the pink color comes back when you press your nail, is super slow. So with this kind of shock, the goal isn't just about pouring in more fluid. That could actually make it worse. The real goal is to save the pump itself. You have to limit the damage to the heart muscle, the myocardium, and use special medications and procedures to help that struggling heart start pumping effectively again.
All right, time for failure number 3. We've had an empty tank and a broken pump. Now imagine this. The tank is full, the pump is working just fine, but all the pipes are leaky and stretched out. This is distributive shock. The problem isn't the amount of fluid, it's the container. The blood vessels themselves have gotten way too wide and permeable.
And the poster child for this, the most common and infamous type, is septic shock. This happens when a massive infection makes the body's immune system go completely haywire. It launches this huge, body-wide inflammatory attack that causes the blood vessels to just relax and open up and leak fluid everywhere. That's why it's often called dilated shock.
And this brings us right back to that chemical fingerprint we talked about. In septic shock, one of the biggest red flags, a key diagnostic marker, is a lactic acid level greater than 2. That number tells doctors that even if the blood pressure seems okay, deep down at the cellular level, the tissues are still starving for oxygen and churning out that dangerous acid.
Now this is where it gets really weird and interesting. In pretty much every other type of shock, the body's alarm system makes the heart beat faster and faster. That's tachycardia. But there's a crazy exception called neurogenic shock, often from something like a spinal cord injury. The nerve signals get all messed up and the heart actually slows down. That's called bradycardia, and it is a massive clue for the medical team.
Another type of distributive shock is anaphylactic shock. That's a massive allergic reaction. And for this one, the priority is simple, it's absolute, and it never ever changes. It's all about the ABCs: airway, breathing, circulation. That massive swelling can close off a person's airway in seconds, so making sure they can breathe is job number 1, 2, and 3. Airway first, always.
And that brings us to our final failure mode, obstructive shock. So in this scenario, the tank is full, the pump is trying to work, the pipes are all good, but something is physically blocking the blood from going where it needs to go. There's a literal obstruction in the system.
A classic example is something called cardiac tamponade. This is where fluid builds up in the little sac around the heart, and it literally squeezes it so the heart can't fill up with blood properly. This creates a classic trio of signs. The heartbeat sounds muffled and far away. The jugular veins in the neck bulge out. That's JVD, because the blood can't get back into the heart. And of course, the heart beats really fast, trying its best to compensate.
And here's another one of those wild exceptions to the rules we talked about. Remember how we said that in most types of shock that blood pressure gap gets narrow? Well, with obstructive shock, it can do the exact opposite. As the heart gets squeezed and can't fill properly, that gap can actually get wider. It's another one of those crucial little clues that points the doctors in the right direction.
Okay, let's put it all together with a quick cheat sheet. 4 failures, 4 core problems. Hypovolemic, that's the empty tank, and a key sign is that the patient stops making much urine. Cardiogenic, the broken pump, you listen for those crackles in the lungs. Distributive, the leaky pipes, you look for that lactic acid over 2 in sepsis. And finally, obstructive, the blockage, where you might see that totally counterintuitive widening pulse pressure.
So you see, what starts as a simple oxygen delivery problem explodes into this incredibly complex, desperate battle for survival inside the body. It's a frantic race against time. It really makes you stop and think, doesn't it? If this is the kind of all-out war our bodies can wage in the ultimate crisis, just imagine all the little hidden, microscopic battles they're fighting and winning for us every single day, without us even knowing. It's pretty profound. Thanks for joining me for this one.